The Nurse Navigator service is for Queenslanders who are in a disadvantaged position, where they have a lot of chronic conditions with a lot of complexity to their conditions, which requires a lot of management across the entire health spectrum. In Cairns, the Navigator services have been around for about 3 years. Last year it was identified that there was a group in Cairns who had quite a high disease burden, and it was seen that a Nurse Navigator service would be able to assist Aboriginal and Torres Strait Islander peoples in their health journey with the complexity that they often have with their health. The Nurse Navigator model of care is underpinned by 4 key role principles, supported by OCTMO, the Office of the Chief Nursing and Midwifery Officer. And those 4 key role principles are patient-centred care coordination, creating partnerships, improving patient outcomes, and facilitating system improvements. In Cairns, for the system Nurse Navigator service, there's 8 Nurse Navigators. We offer contact to Nurse Navigators 7 days a week from 7 a.m. through to 10 p.m. There's a number of patients who each Nurse Navigator works with in partnership to help plan goals, to help educate the patients about their own health, to link them into supporting services across the entire health spectrum, no matter whether that's in ED, in hospital, in the GP clinic, at the patient's home. There is no barriers to that support and care and advocacy that the Nurse Navigators provide.
So I actually like going out into the community and going into people's home and learning about them, because it's in that environment that you actually get to learn a lot about them and about their background.
My name is Anne-Marie. I'm a Systems Navigator at Cairns Hospital. I first met David around 18 months ago when he was referred to our service. David had multiple chronic conditions and was really struggling at home, living on his own, unable to manage his care and his health conditions. So he was referred to us for ongoing support and care coordination in the community.
I've got a lot of trust for Anne-Marie, a hell of a lot of trust. She's always treated me good, she's always done the right thing by me and everything. Yeah. She got me into the place where I am now. John Hollingsworth, I enjoy it there. It's an Aboriginal place. We pay our rent, we get our food 3 meals a day plus our smokos. And sometimes we do trips and that down to Babinda, or the ladies go somewhere and have a barbecue and the men go do a day trip somewhere else, and they're really good there, yeah.
We've seen a big turnaround with David. He was really struggling initially. Living alone, he was disengaged from family and community services. Now he's in supported accommodation, so he's receiving the care that he needs, which has helped improve his quality of life. It's very patient-centred care. We're able to help David reach his goals, so he's managing his health a lot better. He's having regular GP checkups. He seems a lot happier within himself. Generally his health is a lot better. He's also been able to re-engage with family and friends. He's made new acquaintances and has lovely social supports now where he's living. He loves to paint as well, so he's been able to get back into his art and his dot art, which he loves.
I do dot painting in it. I've had the Queen buy one of my paintings off me, and she's hanging in Buckingham Palace. When I started in Alice Springs, the bloke that caught me was Clifford Possum. He's the one that originated Aboriginal painting on the dot painting and that. Well, I just run into a doctor downstairs there. He wants me to do a painting for the hospital, so that's another job I've got to do, so I'll do that for them too. And hopefully they'll hang it somewhere where everybody can see it.
We're able to translate or interpret what the doctors are saying to them in a much easier language for them to understand.
Some of the results that we got so far are really good, and they're all very encouraging. So across the board we have reduced bed days, on average about 40% less for patients who begin to get navigated, 20% less ED presentations. Discharge against medical advice has been halved. Our patients are telling us that they have a better quality of life, that they're enjoying their health experience or their journey into the health system a lot more, and that they're telling us that they do understand their health a lot better than they once did.
And thank you very much for everything that you've done for me. Thank you.